He's worked in England for several years. He comes with lots and lots of experience. He's someone that healthcare is close to his heart, and he likes to give back to the community. So this is a platform for him to share his expertise, engage us, enlighten us, and help us with our daily lifestyle. So Joseph will be talking to us about chest pain, akuma akuma yare for short. Forgive me if I said it. Joseph will be talking to us about chest pain. He would dive into the issues that are concerning for chest. He will dive into the issues of chest pain. Um, I'm sure by the end of today's discussion, a lot of things, a lot of information concerning chest will be sorted, and we will have proper understanding. We will know the do's and the don'ts. We know the simple activities that we can do to help ourselves. Dr. Joseph, I think I'm struggling to catch Joseph at the moment on the line, so I'll give him some few minutes and then he can join us. Joseph, if you can hear me, if you want to quickly introduce yourself in 1 or 2 seconds so that we can start.
Oh, hello, Mark.
Yes.
Oh, yes, sir. I'm sorry. Apologies. I'm online now. Introduce myself. Good morning, everyone. My name is Joseph. I've been on this before. It was, I think, a few weeks ago, and we talked comprehensively about chest pains, not just about cardiology, not just chest pain. But today, I'm just going to restrict it to chest pain. But once again, welcome, and I'm Joseph. I work in cardiology and medicine, and I'm quite passionate about the African health and the heart in general. So yeah, I'm gonna speak to you about chest pain for the next hour or so. So over to you, Dr. Mark.
All right, brilliant. Akwaba, Winina, Akwaba, and that was it. All right, so Joseph, you've clearly said you're going to talk to us about chest pain. Before we get into everything, why chest pain from start? Why do you think we need to talk about chest pain?
Hello, Mark.
Yes, why do we need to talk about chest pain today?
Oh, chest pain is very important subject. Very important subject, and I think for me the most important thing is a symptom that can take you to your early grave if you don't seek urgent help.
Okay.
So that's why I think it's very important, and I think it goes unnoticed. A lot of people stay home and delay before seeking help
Yeah.
for chest pains. So I
Okay.
think it's absolutely essential that we sort this out.
Okay. And to say, I can say chest pain. Do you mean say, can I? Is it safe for me to say akumayare? Is that what you have in mind? Say akumayare as in chest pain, or that's completely something different?
That's complete. It's different. So chest pain is different from aqua area. Aqua
Okay.
area encompasses Arabia and Wakubamu. Chest
Okay.
pain sometimes it might not even be in Akuma. It might be
Okay.
coming from somewhere else. And that's
Okay.
why I said it's very important that when you're
Yeah.
chest pain, yeah, you seek urgent help because
Okay.
is our job to try and tee out
Okay.
or find out. See, very
Okay.
sure who said baby a free bar and
Okay.
see chest pain, no. It's a different from my area.
Okay, all right. Thank you very much, Dr. Joseph, for clarifying that. So what church we say, kumayari and chest pain is not the same thing, but uh, chest pain obviously can also include a kumayari, but there are other many issues that can include or can involve or can be associated with chest pain. Sometimes you can say the chest pain can come in different nature or different forms. What are some of them? If you can say there, sometimes you actually say sharp, and I did this. What are the different types of chest pain that we tend to experience from your experience and from your knowledge? Are you able to tell us certain types of chest pain in terms of the nature of it? You know.
Um, yes, as you said, no. The nature of chest pain will direct us to where we think the pain is coming from. So we
Okay.
have if it's a sharp pain,
Yeah.
if it's a tightness. I say
Okay.
wakuma do.
Okay.
Okay. I say
Yeah.
bibi si wakuma so.
Yeah.
Um, it be a squeezing pain.
Okay.
As the band be as it's so chest you squeezing.
Yeah.
And it be a ache like an ache. Maybe
Yeah.
when your headache and I say it's just throb. It's just
Yeah.
an ache.
Okay.
Um,
Okay.
and sometimes
Mm.
it be a sharp, as I said. So
Yeah.
the nature of the pain will tell us exactly where things are coming from. But whichever
Oh,
one it is, no, you have
yeah.
to make sure you seek urgent help quickly. And then we'll
Okay.
clarify and we'll tell you which
Okay.
one it is.
Okay. Wonderful, wonderful. Okay. So I was here for any listeners. Doctor actually I'm gonna say chest pain. You almost different types. Sometimes it's burning, sometimes it's tight, sometimes it's heavy, and sometimes it's really squeezing. You feel like somebody is having a band across your chest. And these are the things that we are talking about when we mention chest pain. Sometimes, you might even think that you have some gas in your chest. Say wakumem. So, but I know that we Ghanaians we like to pray, and sometimes we want to pray over it. We want to say that it will go by itself. You don't have to pay any mind. So if you're having any issues with any dull, burning, tight, or some heaviness, or some squeezing in your chest, then you want to try and get some medical help. Is what Dr. Joseph is telling us. Dr. Joseph, now before we move on to other things, I would want to ask you another thing. Say,
Mark,
what,
just give me 2 minutes, please.
yeah, we are going to be looking at some of the common causes of chest pain. So I would say for you, we say what are some of the commonest causes? Nyama it cause some of the issues that you mentioned above. Say the dull pain, the burning pain, the tightness, the heaviness, or the squeezing. What are some of the commonest causes? Fine. Sometimes we'll say that okay, I'm having this sharp pain in my chest. Sometimes depending on the location of your chest, is it at the higher part of your chest? Is it at the lower part of your chest? Is it on the left side? Is it on the right side? All of this gives us clue to be able to tell the cause of this pain. So in a very short time, uh, our brother Joseph will be looking at telling us first some of the commonest causes of chest pain. Again, for Aquaba, we are live on Hot Digital Health Corner. You're with your brother Dr. Mark, who will be engaging with our lovely guest today, Dr. Joseph, who will be coming on the show a couple of times to engage us and to educate us. I think his line has dropped in a minute, but he would definitely get back to us, as he said, in 1 or 2 seconds, and then we can continue. Again, I want to apologize to all of you that we are not allowing you or we've not been able to let you call in with your questions and answers. But I have been given all the necessary assurance that in a very short time we might have a call in phone that you'll be able to call in to ask your questions or give us some of the feedbacks and your recommendations. Dr. Joseph, are you back on? Not yet. Okay. So I don't want to take the juice out of Dr. Joseph's mouth, but as I mentioned, we are live on Instagram, we're live on YouTube, we're also live on Facebook. So tell a friend, engage with a friend so that we can all learn and study together. Today we are looking at chest pain, its causes, when we need to seek medical attention. And we know that it's a common disease, it's a common problem among us. It affects everybody, not just the old, not just the young, but it also affects all and sundry. And it can be devastating, it can be catastrophic if you don't give it the necessary attention that it deserves. Just as we're waiting for Joseph to come in, I'll say that located in your chest region, obviously you have your skin, you have your muscle, and then you have your heart, which is what keeps you alive, and then you have your lungs, which is also your breathing organs. Without it, you can't breathe. Obviously, your food pipe, which is your esophagus and the upper part of your stomach, it's also there, located somewhere in your chest. There are other organs that help with our digestion, things like your liver, also down there. And obviously, you have some bony like your ribs, your clavicle, all involved there. And there are also some other nerve structures that are also located in your chest. So you can see there's an array of organs and vessels and tissues that are located in that region. And sometimes,
hello, Mark.
yes, Dr. Joseph is back online. So the space, Joseph.
Yes, Mark. I
I
hope
was.
you can hear me clearly.
We can all hear you. So
Okay.
everyone can hear you. And apologize to the audience for
Sorry,
the
guys.
waiting.
Apologies for going off the technical issues and why.
There,
But yeah, finally back online.
there is a bit of noise in the background, so if you can position yourself, maybe that help.
Okay.
Um,
Okay.
so I was asking you about some of the commonest causes of chest pain. Um, I have taken the liberty to highlight to our audience and our listeners that in our chest there are different structures and different organs. So when we get some of this dull and sharp pain, sometimes it could be a result of them. So I will leave you to break it down for us some of the common causes of chest pain.
Okay. Is the background noise okay? I'm trying to get to a good location.
Yeah, it's all right. Go on.
Okay. As Dr. Mark said, we have different types of chest pains. It could be the muscles, it could be the lungs, it could be the heart. In fact, it could be coming from your stomach. So the examples of the chest, the nature of the pain will direct us to where it is. So the first one I'll talk about is the musculoskeletal type of chest pain. Okay.
Yeah.
This pain usually it can be as a result of trauma.
Yeah.
or excessive exercise,
Yeah.
or a cramp.
Yeah.
Right. So if you have a cramp, you can have chest pain. So if you're going to a gym, for example, or you've been walking a lot, you've been doing a lot of things,
Yeah.
activities, you can have some chest pain.
Yeah.
But it might be very difficult to distinguish this chest pain from other types of chest pain. And that's why I would say or stress the fact that you should go to hospital to have it checked out. Okay. To have an experienced clinician to speak to you, maybe do a couple of tests and come out to your conclusion. Okay. So
Yeah.
that's the first one. This pain is usually is an ache. It's an
Okay.
ache. It's an ache like when you're having a chest ache. Okay.
Yeah. Yeah.
Um, the second pain I will talk about is probably the most important chest pain is
Yeah.
the cardiac or the heart chest pain. We have different types of heart chest pain. Okay.
Yeah.
We have pain that could be coming from the lining of the heart called pericardium.
Yeah.
Okay. This pain can cause something called pericarditis. If you have inflammation of the lining of your heart, it can cause
Yeah.
pericarditis. It's
Mm.
very common indeed, and a lot of people
Yeah.
do not realize that
Mm.
in fact they actually have this condition.
Yeah.
And it arises when you have a cold or you have had like a viral symptom, viral illness.
Yeah.
Then a couple of weeks down the line, you can have some chest pain.
Yeah.
And this pain is usually sharp.
Yeah.
It's very sharp chest pain. And
Yeah.
it's worse when you take a deep breath in.
Okay.
And it's better when you breathe out. It's worse when you lie down flat.
Okay.
And
Yeah.
it's better when you lean forward.
Okay. All right. Wonderful,
Um,
Dr. Joseph. Before you go on, so
yeah,
just to recap, you said that the pain or the issues we have in our chest could be from our heart, it could be from our lungs, it could be from our stomach, it could be from the bones, it could also be from the muscles. So you see, uh, 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 um, fellow friends, it's not every chest pain that is a heart attack. Am I safe to say that?
yes, definitely, definitely.
Yes. But also, we have to respect all of them. Is that correct?
Correct.
Good. So if that's the case, if I take you a step forward and say and ask you what are the red flags? What are the red flags, that when we see or we feel so that we can educate our audience that if you see or you notice or you feel some of these, what I put in quote, red flags, then you need to seek immediate, help from
Mark, 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 I mean, it's a very, very good question. But as I was saying from before,
yeah.
right? Said Americano.
Mm,
Me, when it comes to
yeah.
chest pain itself is a red flag, Mark.
Okay.
Right. So once you get chest pain, you don't need to wait to have any other symptoms
Okay.
to see immediate help. As soon
Okay.
as you have chest pain, you have to seek help
Okay.
because some of these red flags can intertwine and it'll be
Yeah.
difficult for you to determine. Sometimes very difficult for primary
Yeah.
care physicians
Yeah.
to determine. So I'm
Yeah.
sure, sir, people listening to me, so be on your chest pain that.
Yeah.
GP now, they won't even tell you to come to see them. They will tell you straight
Yeah.
to go to A&E. Don't even come here.
Okay.
So for me, chest pain itself is a red flag. So
Okay.
so usually once you have chest pain, for me
Yeah.
it's time to go to A&E.
Yeah.
Even if you're going to spend 10 hours in A&E, it's better to stay there, have some
Yeah.
blood tests, have some ECGs, and have someone speak to you properly before you go home. And that
Okay.
for me, that is the way to go. Okay.
Okay. Okay.
Because
Okay.
if you say you focus on train on your red flags, you miss it. Because
Okay.
I'm gonna talk about heart attack in a second.
Okay.
Heart attack, sometimes they don't always present the way we think they present.
Okay.
So
Okay.
and also it's so it's always very important,
Yeah. Yeah.
to go. And I'll say okay, if you push me, a red flag is maybe your age,
Yeah.
right? Because we know some of these chest pains are age defined. So if you are, let's say, below the age of 25,
Yeah.
it doesn't mean you can't have a heart attack. You can have a heart attack below the age of 25, but it's
Okay.
rare. It's not common,
Yeah.
right? It's not
Yeah.
common. So if you have a chest pain, anyone below the age of 25,
Yeah.
then you're likely to have something called pericarditis or some sort of other chest pain rather than a heart attack.
Okay.
Okay,
Okay.
but
Okay.
you still have to see a physician. But
That is that.
if you're at the age of 30, then
Yeah.
you are it's fair game. If
Yeah.
anyone can have a heart attack below your 30.
Yeah. Wonderful, wonderful. That's an important piece of information. We are almost half um an hour on the clock. We want to thank everyone for being on the show and listening. A special thanks to those who are joining us on Instagram and on YouTube and Facebook. Share the link to your friends. Let them be part of this. Engage, interact. We have our words. We are making plans and arrangements, so you'll be able to call in and engage and interact. And so Dr. Joseph has kindly informed us that chest pain by itself is red flags. But I'm going to push him a bit harder and ask him some other things because I think that sometimes we downplay chest pain. So sometimes Dr. Joseph, sometimes you have this chest pain and it comes with the pain that spread, for example, to your arm, or it goes to your jaw or to your back, or sometimes there's sudden shortness of breath, or sometimes there's sweating and dizziness. All this sometimes comes with it. Or the chest pain, which is your chest is beating fast, or the pain is fast, or the pain starts during your exercise and it stops when you rest. So these things, does it give out any other extra information? Are these some of the red flags as well?
Yes. So these are, I'll say these are discriminants.
Okay,
Discriminants in a sense that to me, if you come to the hospital to me, it
yeah,
will tell me where your pain is likely to come from. So they are
o-
discriminants for me, the physician or the cardiologist. Okay.
okay, yeah,
But yeah, for me, they are discriminants. But it will give you the patient, remember what idea, yeah,
yeah,
what will be going on. So as Dr. Mark has said, so the nature of chest pain. So a chest pain that when you walk, it gets worse,
yeah,
it gets heavy on your chest, and it gets worse every time you walk. Every time you're antibiano, now
yeah,
drew. Then you have
yeah,
to stop.
yeah,
You have to stop for the pain to disappear,
yeah,
right?
yeah,
And then as soon as you carry on to walk again, the pain comes again. This is called
yeah,
angina. It's
okay,
called angina, and this is
yeah,
the angina. If that this is the one that if you don't have a look at it or get someone to look at it to treat it, you have a heart attack in
yeah,
in the near future. So this
yeah,
this is probably the most important chest pain. It's called angina. This pain can also go to your chest, sorry, your neck. It can go to your jaw. It can go to your left arm. Okay.
yeah,
So anytime your left arm is heavy and you don't have any cause of it, or your
yeah,
jaw is heavy, or your neck is heavy, and you don't have any cause for it,
yeah,
again, seek a medical help. This could be angina. Okay.
okay,
When you walk, then your jaw is heavy. When you walk, your neck is heavy. When you
yeah,
walk, your arms are heavy. All
yeah.
these are pointing to the fact that you could have an angina. So again, seek help. Okay.
Wonderful, wonderful, wonderful. That's very useful piece of information. I'm liking this. I'm glad you are sharing this information with us. I will share a story with you, Dr. Joseph, and see what you think about this story. So we have our lovely brother from our own Ghanaian community here in the UK. Let's call him Kofi for what is worth. So Kofi felt some chest tightness one evening. He said, "Oh, it's just pepper from the wachi I ate." He drank water, paced around, even took some ginger, but the pain got worse. His wife insisted they go to A&E. And guess what? It was an early heart attack. The doctor said if he had waited another hour, the story could have been different. Is this a common scenario? Is this something that you see in your practice a
Well,
lot?
I think you basically led the whole session for me because that was the next bit I was coming to actually. So I was coming to MI or myocardial infarction or heart
Yeah,
attack. Okay, so
yeah,
I was speaking angina. The next
yeah,
one is what we call acute coronary syndrome or heart attack. Okay,
yeah,
so the symptoms of heart attack, okay, could be angina again,
yeah,
but this time when you have the chest tightness, it does not resolve.
yeah,
When you rest, the pain does not resolve. When you sit down, the pain doesn't. Whatever you do, the pain is still there.
yeah.
This is heart attack, and you have to see someone as soon as possible.
Mm,
So the second symptom, as Dr. Marcus said, is you would have sometimes we call it heartburn,
yeah,
like exactly as Mark described. sometimes we feel say, oh, me this is heart attack in disguise.
Yeah.
You know, you take Gaviscon, maybe Gaviscon might help a little bit. You take something out, but still it will be in the background. This is heart attack. If you don't come in, you'll probably be dead in the next 2 hours or so.
Yeah.
So yeah, so this is called acute coronary syndrome or heart attack. Okay.
Okay. Okay.
Um yeah.
Well, nti abusuafo sometimes na nye aduane na wadi ne enye fufuo no enye waache no and enye moko no, it could be early signs of a serious heart problem. The answer to that issue or the way to deal with it is to seek an urgent or immediate health attention. Don't think that the food you eat sometimes can cause chest pain. Yes, sometimes some of these things can cause heaviness. It can fall on us. Like I always say, every time my wife cook and I eat so much, I say, "Oh, the food has fallen on me. I can't do anything." But as you're mentioning, if it is pain by itself that is not going away, that's not getting better, then don't downplay it. Don't say ego go, as we always say. Don't say this one no be nothing, this one just be what? It be some fufu chop, any problem. So let's pay particular attention to our bodies. Let's listen to our body when it speaks. Listen to it and act on it. Seek the right help. A big good morning to all our listeners for being wherever they are. Some of you are probably at work, some of you are in your homes. You are listening to us live. It is us again, your doctor's time, our corner. Call it whatever you want to call it. We just want to relate. We just want to come with you with some health points, topics, things that you can take home, things that you can use readily available, readily relate, so that you can have this information. When you have this information, obviously, at the end of the day, it comes down to you, what you want to do with it. It's not replacement for your GP, it's not replacement for your hospital care, but we think that at least sensitizing, enlightening ourselves, engaging is the way to go. I'm glad you take the time to join us every morning. So again, thank you. Thank you so much. I have a few more questions to our host today. Joseph, so you have said we should call emergency service immediately or go to hospital immediately if the pain we have just present to us. What are some other things that we need to stop doing immediately? For example, sometimes it can happen even when you're driving. Sometimes it can happen when you're watching your TV. It can happen when you're walking. Do you need to stop to rest? Do you need to park your car? Do you need to call somebody? Sometimes we take aspirin at home, things like that. So what are some of the things, the easy and common things that we need to do immediately, what you call the event, time? If you can draw some points on us for this, it will be helpful for our audience. Thank you.
Thank you again. As I was saying, right, when it comes, there are a lot of conditions in the body. Conditions in your body anymore. It's straightforward. When your headache, for example, when your headache, I know the straight. Straight away it's headache. So you can take paracetamol, whatever it turns out to, whatever it is, the paracetamol help the headache. But with the chest pain, right? That's what I'm saying. Where you can, it might even turn up to be something called pulmonary embolism or blood clot on your lungs. The way the pain described. So the chest pain, I don't usually tend to advise people to take actions on their own. Okay. And as I say, we are very fortunate in this country where we have emergency services that respond to us very quickly.
Yeah.
Especially chest pain. When you mention chest pain, they take it seriously. I know not all the emergency services, but the vast majority of them take it very seriously. So we are very fortunate about that. So when you get chest pain straight away, the first thing that should come to your mind is, I'm calling emergency services. I'm not sure this chest pain. Let me call. If you call NHS 111, they will advise you on it. Okay, they are very trained. They are very well trained on it. If they think you're having a heart attack, say when you heart attack, or advise you take aspirin, aspirin. Okay.
Yeah.
before the emergency services arrive. So advise anyone above the age of 50 or
Yeah.
45 to have some aspirin at home.
Yeah.
Just buy aspirin. It's very cheap. Local
Okay.
aspirin 75 milligrams. Just buy it and keep it at home.
Yeah.
Okay. In case of anything, Biana, they will advise you to take some of them. They'll tell you exactly how much you take.
Okay.
So,
Okay.
so, so these are things that you can do. That for me, Mark, the
Yeah.
take-home message I would want to drive into today is chest
Yeah.
pain that you are not sure about means calling emergency service or calling help, and then
Yeah.
someone will tell you exactly what a chest pain is. It doesn't matter if you waste your time for 5 hours or 6 hours or 10 hours. I think it's worth it, because if you don't do it, the consequence of it would be very, very severe. And I don't know. So the consequence of the outcomes, if it's a heart attack, number one, it could be the most important thing, you would die from it.
Yeah.
Number two, is you can have what we call heart failure. All
Yeah.
right, heart failure is if you survive this heart attack, now your heart might fail, which means it will not pump properly.
Mm.
Okay, you have
Yeah.
all sorts of symptoms. You on tight.
Yeah.
Would on crabby no bread.
Yeah.
In sube o chest or cocoa. In sube jina akuma home.
Yeah.
All these things might happen to you, and in
Yeah.
fact, you might die. You might die early.
Yeah.
You might have something called arrhythmia. Arrhythmia is when wakuma no ball peri, and
Yeah.
then eventually, it goes into a very, very dangerous rhythm. Dangerous rhythm means
Yeah.
wakuma no fast too much.
Dr. Joseph, I'll hold you there for a minute. I'm going to come there, with some of the post cardiac or heart problems issues. But before that, I just want to reiterate to our listeners and our audience that, as Dr. Joseph has clearly mentioned, if you're above the age of 50 years upwards, it's all right to have some aspirin at home. But he did clarify and make it categorically clear that you don't take this medication without speaking to what? A doctor. You don't take this medication because I know all of us, almost all, every Ghanaian home has an aspirin. Ampicillin, as we call it. Or I don't know, maybe I've said it wrongly,
No,
but
ampicillin is different.
maybe ampicillin is antibiotics. But yeah,
That's what that's antibiotic. Yeah.
but aspirin is very common in almost all homes. I have some aspirin in my home, and sometimes I take it if I have a bit of headache and all of those stuff. So, but if you're having issues with your chest, don't take aspirin just by yourself without calling either 911 or 111. So, you need to get a doctor to say, fine, all right, the things you're telling me, I think aspirin might be helpful. So, don't treat your own chest pain. But I think it's safe for us to say that if you are driving whilst you've had a chest pain, then by all means you need to what? Park your car, stop on the side and call 111 or 911, or call somebody who can what? Come and help you. So if you are doing certain activities, then by all means take a rest, and then you can get the necessary help care that you can get, because the reason why it's not good to self-medicate is because it could be anything, you see. And sometimes one medication does good for one particular problem, whilst it can make another issue worse. So it's important for you to be very cautious. Joseph, before we go into the post uh, heart failure, whether complications or effects or side kicks, as we call them, what are some of the preventive measures that we can take? But there is an old adage, and there is some prejudice and some information that, some you don't have to eat pepper, and you have to reduce your salt and all these things. What is your take on the correct preventive measures, to obviously prevent us from having chest pain? I'll say chest pain. I will not limit it to just heart attack, or for that matter.
Mark, if you limit it to chest pain,
Yeah.
then this is going to be a whole kind of worms, as we say. Because
Yeah.
as I said, chest pain could be cardiac, it could be lungs, it could be from your stomach, it
Yeah.
could be from your muscles, it could be from anxiety, panic related, something even from shingles or herpes zoster, as we call it. You
Yeah.
know, so that would be a lot of things that you could do. So
Okay.
for the purpose of this presentation this morning,
Yeah.
I think I'll limit to heart, right?
Yeah.
Let's limit it to heart
Mm.
because otherwise I'll end up going some to other things that I didn't plan to do.
Yeah.
So for cardiac chest pain, there's something that the most important thing that we can do to prevent or help us prevent having a heart attack, I'll limit to again heart attack,
Mm.
is number one, the best thing to do for yourself is never to smoke. All right. If you smoke, you quit.
Okay.
The second thing is um to check your cholesterol, your blood cholesterol levels. Okay.
Yeah.
If your cholesterol is high,
Yeah.
then you have to change your lifestyle in terms of your diet, in terms of what you eat.
Yeah.
Um, if the diet alone is not able to control your cholesterol, then you go on tablets called atorvastatin or
Yeah.
statins. And I know people complain that statins give them muscle aches and cramps and things like that, but we do have other medication that help control your cholesterol very well. Some called
Yeah.
ezetimibe, bempedoic acid injections, and there are a lot of things other than statin. But the one everyone knows is statin. But there are lots of other things that you can use.
Yeah.
The third thing I would say is um, try not to get diabetes if you can't help yourself.
Yeah.
If you, of course, if you got diabetes already, then make sure your diabetic control is very, very good.
Yeah.
Okay. And the way to try not to get diabetes, number one, is again diet. So we need to
Mm.
cut out a lot of the carbohydrates that we eat. I know our foods are very heavy of carbohydrates. You know,
Yeah.
yam, fufu, rice, ampesi, banku. These are all carbohydrates. And
Yeah.
the way to get, not get diabetes or reduce your risk of getting diabetes, so unya diabetes now, reduce the carbohydrate intake now, right?
Yeah.
I'm not saying don't eat it. You can eat, but the
Yeah.
portion size should be very small. It should be very, very
Yeah.
small. So you
Yeah.
should eat small, say fufu, small fufu, but a lot of soup, a lot of fish, a lot of these meat and that sort of thing. Bayre, kakrebi, mianupe, okay. Bodia is actually very good. Bodia is not part of the heavy carb. Bodia gives you a lot of other minerals and ions and other. So Bodia itself is good. Um, Exercise. You have to exercise very well. You burn the excess calorie that you eat. You
Yeah.
know. Number three is check your weight loss. Check your something called central obesity. Central obesity is the belly fat.
Yeah.
That's the most important fat in your body. So if
Mm.
your belly fat is bigger than your waist, it's
Yeah.
called the waist hip ratio, right?
Oh.
Or the waist hip ratio. You check your hip and check your waist. If your waist is so much bigger than your hip, then you know that you're in trouble. Okay,
Yeah.
that means you have to try and cut down. Right now,
Yeah.
again, nowadays there are exciting innovations coming up. These
Yeah.
injections, Ozempic, Monjaro, all these things, they are very good at getting your weight down. Obviously, they do have their risk factors, but before you take it, no, you have to see a healthcare professional to go through the risk factors reduced, just so you're taking it safely. These medication will get your weight down significantly within a couple of months.
Yeah.
And that will reduce your risk of having diabetes. Because diabetes is one of the biggest risk factors for heart attack,
Yeah.
aside smoking, cholesterol.
Yeah.
Diabetes is pretty much the most important the biggest risk factor. The other thing is blood pressure.
Yeah.
Blood pressure goes without saying. I think next time when I come on, I'll just talk about blood pressure specifically. So I'm not
Yeah.
going to waste time on it. So get your blood pressure down. If you don't know your pressure, go to your hospital, check your blood pressure. If it's high, you give it some medication. Again, exercise help. Low salt diet helps. Drinking water helps. All these things help. One
Yeah.
thing I would say is, Mark, if you check your family history, check your family tree. If
Yeah.
anybody in your family has had a heart attack before, then you know you are at a very high risk of having another heart attack. So if your mom has had a heart attack, if your dad has had a heart attack, if your brother has had a heart attack, or if anybody's had any heart procedure relating to angina, then it means you're high risk of getting these things. So you have to take all the other precautions I've said very, 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 very important, because otherwise you would get a heart attack at some point. Last
Yeah.
thing I would say, Mark, because I think our time is going, about heart attack, is
Yeah.
even if you control all these risk factors, you run, you eat well, you exercise, you don't smoke, your blood pressure is down, you don't have diabetes, you don't have cholesterol. In spite of all these things, you
Yeah.
can still get heart attack, but your risk of getting heart attack is very, very low.
Oh.
Very low. It's like maybe 5%, 5 in 100. Whereas if you don't control any of these risk factors, your chance of getting heart attack is about 80%. So you see the difference. It's very, very, very huge.
Wonderful, wonderful, Dr. Joseph.
If Mark, if you do have a heart attack, right?
Yeah,
In spite of all this, if you do have a heart attack, call 999. If you do end up with someone like me, a cardiologist that treats heart attack, then the good news is that you're in a country where we're able to treat this very, very easily. Okay,
yeah,
very, very easily. We can treat it very easily. So
yeah,
do not stay at home. We will put some wires down your groin or wires down your arm, going into your heart, and sort this problem out.
yeah,
So you are in a safe country. Do not stay at home.
yeah.
Okay, do not stay at home. Okay.
Wonderful. Busiafo, we know that we are running out of time, but we still have a few things that we want to enlighten you about. Uh, Dr. Joseph said something that I don't know, but if about you or but he said waist and hip ratio. And I always thought the waist and the hip were the same things, but it looks like they are not. So, check your waist, check your hip as well. Make sure they are not out of proportion, that you're doing your gym sections, you're doing your walking, you're doing all the things that are necessary. So, I mean, he did mention something that I think is very important, and I want to emphasize on that. That if you have an uncle, a mother, a father, or you yourself have diabetes or hypertension, it's very, very important to not downplay those things, because, or if you smoke and your cholesterol level is high, because it puts you at a high risk category for heart attack. What I would want to ask Joseph, if he could, clarify for us, is that he said that in spite of all the things that is mentioned that you can do to prevent heart attack, you can still have heart attack even if you're absent from those things. But I wonder what is then that cause heart attack if you don't have hypertension, diabetes, or etc. Is it what then can cause heart attack? Is it coming from some juju or something? Joseph, are you able to throw some light on that?
Yes, that's a very good question, Mark. Okay, so these are the biggest risk factors, as I've mentioned.
Yeah,
Um, sometimes. So let me explain what causes a heart attack. Heart attack is when the arteries around your heart, the arteries that supply the muscles of your heart, suddenly gets blocked. All right. Now,
yeah,
over many years, the things that block the artery are the ones that I've said: cholesterol, smoking, and all these things, diabetes.
yeah.
Sometimes, even if your arteries are clean of these, fatty buildup, a blood clots from somewhere in your artery in your body can go into your artery and block your heart. Okay,
Yeah.
so sometimes you can have some diseases that make you clot your blood quickly,
Mm,
right? So what
mm,
disease are ultimate clot or artery quick onya blood clot in tema. Some of these
mm.
blood clot can go into your heart artery and also cause a heart attack.
Yeah.
But these things are rare. They are not common. They are rare.
Mm,
That can happen if you have irregular heartbeat, for example, some called atrial fibrillation. If you have
mm.
big irregular, sometimes you can clot if you don't take a blood thinner, for example, and that
Yeah.
clot can go into the artery of your heart. Okay,
Yeah.
and that can cause a heart attack in itself. So and there are some other very rare causes that I don't want to go into. So anything that can block your artery can cause heart attack. Blood clot is the biggest one that can do that. Okay, so regardless of all the risk factors, as I've said, you can have these other rare things that can cause heart attack.
Well understood. But that is very good. I'm not sure if there is background there in your noise. If you can adjust the position for us, we'll be happy. Um, Thank you, my fellow listeners and audience. We've been talking about chest pain. We've narrowed it down to heart attack because we know it's a deadly disease that if it's not given the right attention or the right um, importance that it requires, it can curtail our life or it can bring us to our demise. So I will not downplay it at all. It's deadly, it's deadly, it's deadly, it can kill you. Um, it's nothing to joke about. Life is precious. We need to protect it. We need to keep it. We want you all to stay healthy. We want you to be strong, dancing at all next community events that you attend to. If you experience any chest pain, please see your doctor. If you had some and you've not gone to the hospital already, please do. Don't sit on it because it can be uh, it can it can be deadly, and we don't want that. Um, Before we end, I want to say that if you still have some comments, you still have some input, you can put that on Instagram, on YouTube comments or Facebook comment sections. I believe that you all have our WhatsApp number. Uh, for now, I think also I should have said this from the beginning, but I believe that if you drop in a message on the WhatsApp number, we will be able to read and answer. So those of you who don't know the WhatsApp number, I would tell you it's probably now, but for next week you can drop us a message on WhatsApp, which is 0709